Hey everyone, my name is Casey and I am a senior dietetics student here at USI.
And my name is Beth Young. I'm a registered dietitian and instructor here at USI. Today, we're going to break down the nutrition facts label and hopefully give you a better understanding of how to read and interpret the label. Nutrition labels are required by the Food and Drug Administration for most prepared foods, such as breads, cereals, canned foods, frozen foods, snacks, desserts, and drinks.
I'm sure most of us have read or at least noticed a nutrition label on our packaged food items, but they can be kind of tricky to navigate. The first thing to know about nutrition fact labeling is that it is mandated by the FDA or the Food and Drug Administration. So there are certain rules that food companies must follow. On every food label, it is required to tell you what one serving size is, how many servings are in a package, and how many calories there are per serving. It's also required to list the total fat, saturated fat, and trans fat per serving, the total carbohydrates, fiber, sugar, and added sugar per serving, and it will also list the total grams of protein per serving, as well as vitamin D, calcium, potassium, and iron.
Another area that you will see on the food label is the daily value percents. Now on the label that's behind us, it's the area that's highlighted in blue, and you'll see those percents along that far edge. The daily values are a percentage based off of a 2,000 calorie diet. Now, the one thing to keep in mind when it comes to daily values is not everyone consumes a 2,000 calorie diet, so there are still ways that you can use those percents to help you make healthy choices with your food, even if you're not consuming exactly 2,000 calories. When we look at the percents, we can use a good rule of thumb of using 20% is a high value and 5% is a low value. So we can use this when we're trying to incorporate healthy nutrients into our diet, or if we're trying to reduce maybe some unhealthy nutrients in our diet. So one example would be fiber. Fiber has numerous health benefits and is something that we want to have in our diet. So we can look at the daily value percent and try to compare food labels and pick a product that is closer to that 20% as opposed to lower to that 5%. Then on the opposite end of that, we can use the daily values to help us gauge a food item that we want to try to reduce maybe a nutrient that's not so healthy. So let's say you had high blood pressure and you were trying to watch your salt or sodium in your diet. We can look on the label and compare products and get the one that has the lowest percentage of salt on that daily value. So we would try to get that sodium level to be closer to that 5% range on the daily value.
Ingredients are also listed on the food label, and they will be arranged in descending order by weight. So for example, on this box of granola bars, the first ingredient is whole grain rolled oats. So that is the ingredient that is the largest by weight. And the last ingredient is peanut flour. So that would be the ingredient that is the smallest by weight. Try to choose food products that have simple, real, and minimal ingredients. This way you know exactly what you're putting in your body.
Another piece of information that you may commonly see on food packages is a use by date or an expiration date. Manufacturers are going to provide this date to help consumers and retailers decide when food is at the best quality. Except for infant formula, dates are not an indicator of safety, but they're an indicator of the quality of food, and they are not required by federal law. The quality of perishable products deteriorates after that date passes. However, such products should still be safe if they've been handled properly. Consumers just need to evaluate the quality of the product prior to its consumption to determine if there's been any spoilage on that product. Here are some examples of some commonly used phrases seen with dates on products. Now remember, these are not an indicator of safety, but they are an indicator of quality. A best by or used by date indicates when a product will be at its peak flavor or peak level of quality. A sell by date is going to tell the store how long that product can remain on the shelf. A use by date is going to be when it's recommended for that product to be at peak quality. A freeze by date is going to indicate when a product should be frozen to help maintain that peak quality. So the question you may be asking yourself is, are foods safe to eat after that date has passed? Yes, a product should still be safe and wholesome as long as it's been stored properly and handled properly and that there are no signs of spoilage on the product. In an effort to help reduce food waste, it's important for people to understand that the dates are applied based off of a food quality and not a food safety. So it is still safe for a food to be donated if it's after that expiration or use by date. The quality of that perishable product may start to deteriorate after that date has passed, but the product itself should still be wholesome as long as there are no signs of spoilage. So a food bank or other charitable organizations can still serve this product. They just need to inspect and look for the quality of the product prior to either distribution or consumption.
We hope that the next time you look at a food nutrition label, you'll be more comfortable interpreting what it says.
We hope you learned some things today to help with your meal planning and grocery shopping, and thank you for spending some time with us today.